morning all. I will be presenting a case series of multistage oral mucosal grafting for reconstruction of severely contracted ocular socket. So as you know, when we face the world, it is your face which comes forth, and in these present days of selfies and social media, your facial appearance is most important. So if the person who has developed oculoplastic requirement and he has a contracted socket, it requires a optimal cosmetic improvement. So socket contracture can be by various causes, as you all know. Even the repeated socket surgeries to correct the socket contracture can also lead to further contracture. So basically, you have to give the cosmetic enhancement to the patient by giving the properly fitting ocular prosthesis. Many surgical options are available when the patient comes, and if you see the literature, when you go for that severely contracted socket, let's say grade 4 and above, or grade 3 and above, the literature will describe dermis fat graft as one of the option for the contracted socket. But though DFG has been extensively studied, harvesting DFG and harvesting requires surgical skills, and it is very difficult to master. However, the mucous membrane grafting is what many of the general ophthalmologists also can be doing in their practice, because even the oculoplastic surgery, even the fellows, they are tuned to get a graft, including full thickness graft. So this study was aimed to find the feasibility of using MMG only for the repair of severe contracted socket. So these were the inclusion and exclusion criteria, and the contracture was as per the Gopal Krishna criteria, and grade 3 and above were contracted as taken as a severe contracture. Comprehensive evaluation including inferior fornix depth was taken. These were the few cases. You can see there are grade 3, grade 4, even a case of blast injuries and severely contracted socket, grade 5, where is a malignant socket. So all surgeries were performed under the GA, and mucous membrane graft was harvested from the lower lip after adding the additional 25% area in the defect. And this was transferred, and then a snugly fitted temporary conformer was given. These are the surgical steps for this procedure. As you can see, after this graft was well taken up, inferior fornix was formed. This is the stage 2 procedure, and the conformer is there in place. So what was done in this study? So when you grade 3, grade 4 or grade 5 contracted socket, we are giving the first mucous membrane grafting. We are re-evaluating the socket again after 6 weeks. At this stage, adequacy of the fornix to hold the conformer, donor site reepithelium was assessed. Repeat surgery was planned after 8 weeks post-op, and the same surgical steps were repeated, and the MMG was also harvested from the same site of lower lip mucosa. So what are the results? As we had taken this, since it was a cross-sectional, it was not it was basically a non-comparable study. We had taken 7 patients, 4 were females, 3 were males. Two patients had sustained blast injuries, and 2 patients had enucleation done with implants. Grade 4, where the maximum number of cases were of grade 4, that is total number of 5 patients were in grade 4, 1 patient was of grade 3, and 1 patient was of grade 5. These are the characteristics of the patient, and number of socket level, this is the socket contraction, and the number of MMG stages required. So we had given 3 stages of mucous membrane grafting from the same site, harvesting of the mucous membrane grafting. What were the maximum dimensions of the MMG which was to be harvested? The average horizontal diameter was 28, vertical was 15, mean fornix depth preoperatively was and post-op 8 weeks was 2.9 millimeter average and 6.2 millimeter average. So it was statistically significant increase in mean fornix depth. Customized prosthesis we were able to give to 6 patients after giving the multiple stage of MMG. Donor site from which we had harvested the mucosa repeatedly, that is the lower lip mucosa, there was no complications. There is not, once you harvest the mucosa, if you have to take it properly without causing the damage to the lip muscles, so that it regrows, and you can take the mucosa again from the same site, which is easy to harvest, rather than going for the buccal mucosa or going for the other stage. So if you see the discussion, if you see the studies, many studies will be there for grade 4 and grade 5 with DFG. there was one study which showed 658 DFGs were compared. But I don't think anyone gets so many cases of DFG, and even there are taboo for the patients also to give the to give the consent for the DFG to harvest from the buttock. So what we are saying is multi-stage surgery with the reassessment of the residual contracture, and not trying to achieve the results in one go, but repeated planning, and will be able to give a good furnish depth and good cosmetic appearance to the patient. Thanks.
Did you keep any fixed interval between your
8 weeks.
8 weeks, from first to second, second to third? 8 week minimum. 8 weeks.
Professor Solly Mandol. Next
But
presenter.
you are repeating the surgery again and again. You are giving general anesthesia to the patient. So why so many surgeries? We can go with other modalities of management.
That's what we are comparing. When the other modalities, when we say for grade 4 or grade 5, it only comes forth is DFG, which is poor. But how many surgeons, even the oculoplasty surgeons, are able to get the DFG? And if the DFG fails or there is an extrusion, then you are in a phase what to do next. So in this case, basically, after to achieve or give the cosmetic processes, you have to have a good furniture depth, and that can be achieved with mucous membrane grafting. Mucous membrane grafting everybody is doing. Even that fellows we are also giving to them. So which is easy to the surgical technique.
You've been doing it under GA every time?
I have done most of the cases under GA. Few cases I have done under local. Basically, when you try to get the furniture tape and surgical grade 4 or grade 5, you try to make the scar tissue release under local, it becomes very difficult.
How about the donor site? Donor site.
Donor site complications, there were none.
Because you have taken multiple times, no?
Yes, there was none. And
Not possible that there would be none.
when